Mr. Speaker, I rise in strong support of the Dingell-Murphy bill, H.R. 5613, which would delay 7 Medicaid regulations that would shift billions of dollars in costs from the federal government to states, counties, school districts, hospitals, and other medical providers. There's absolutely no justification for such a cost shift, especially at a time when many states are struggling to avoid budget cuts as their economies slow and revenues decline. The bill would delay the implementation of these regulations until April 1, 2009. The Oversight Committee held hearings on this matter. We heard testimony from public and teaching hospital administrators, emergency room physician, child welfare worker, and a school nurse. They explained how the regulations would shift costs to states and localities and what that cost would mean for access to services for beneficiaries. We also heard from a representative from the Centers for Medicare and Medicaid Services, which issued these regulations. And since Medicaid is a federal state program, one would think that when the federal government changes the rules, as these regulations would do, it would first try to determine what the impact of these changes would be on the different states. Well, we followed up with the head of the CMS for Medicaid, and he told us that he had not done a state-by-state specific analysis of the impact, and he had no plans to do such an analysis. So our committee made our own analysis, and we did a survey of Medicaid directors for 43 states and the District of Columbia. And they told us that if CMS were allowed to implement all 7 Medicaid regulations, their states would lose nearly $50 billion in federal funds over the next 5 years. The result of these cost shifts would not be greater efficiency. It would not be a savings of money. It would simply come out of the reimbursements and fewer eligible populations. They would disrupt the existing systems for care of fragile populations such as adults with severe mental illness or children with special health care needs. They would undercut the financial stability of hospitals and emergency rooms that treat Americans without health insurance. They would impose large new administrative burdens and costs on state Medicaid programs without any offsetting policy benefit. In short, the best professional judgment was that the regulations would have harmful fiscal and programmatic consequences for their states and the people that look to the Medicaid program as the safety net for health care. The bill before us gives the Department and the Congress the time to look into these issues in the detail they deserve without making fundamental changes in Medicaid policy. I urge support for this bipartisan legislation.
The gentleman from Michigan continues to reserve